Good afternoon, everyone, and welcome to our webinar on speech therapy. This has been organized and done by the Parkinson's Disease and Movement Disorder Society, which is an all India registered charity society formed in 2001 by Dr. B.S. Singhal, head of neurology, Bombay Hospital. Our society currently has a support network across India for people with Parkinson's and their caregivers, their families, who can provide a multidisciplinary rehabilitation program. Our society offers a lot because of the pandemic. We offer a lot of online facilities, so weekly online exercise sessions, information on management of Parkinson's, phone counseling for people with Parkinson's and their caregivers, as well as online sessions for caregivers. So these are the sessions that we are providing at the moment because of the pandemic. The Parkinson Society Goa, which is affiliated to the PDMDS, is a society registered in Goa itself and provides free of cost multidisciplinary rehabilitation services for people with Parkinson's. We have support groups at Panjim, Mapsa, Margao, Ponda, and Basco, where we have people with Parkinson's who come together where to do their exercises and other rehabilitation programs that we have. Currently, we are running all our sessions online because of the lockdown, which is open to all people with Parkinson's. And on your screen, you will have our contact details, our phone numbers, our email ID. So if you have not already been registered, so please get in touch with us. Or if you know someone who may also benefit from these services, please inform them about our services. So these are once again all our contact details. For this session, we have a disclaimer that you should know of. The information that we are providing helps promote a healthy lifestyle to support you on your journey with Parkinson's. But before you do any kind of changes to your program, please get in touch with your doctors so that they are aware of what you are doing. So that especially if you have symptoms like breathlessness, palpitations, dizziness, stop the activity, sit down and rest. And if the symptoms persist, then you have to get in touch with your doctor. Also note that these sessions are recorded and photographed, and it is the property of PDMDS. So by participating in this program and activity, you confirm that you have read, understood, and agree with the disclaimer and consent that to use of these videos by PDMDS. So we welcome for our session today Lara Mendonsa, who is an audiologist and speech language pathologist. She has completed her master's degree at Manipal University and has been practicing in Goa for the last 3 years at her clinic named Tokatan. So we welcome her here today, and we're very happy and delighted that she could be a part of this webinar.
Yes, Lara, you can go ahead. Okay, hello everyone. Today I'm going to be talking to you about what role a speech language pathologist plays with people who have Parkinson's. Before I move on to that, I just want to go into a little details about what a speech language pathologist is and what we do. Okay. Okay. So what a speech language pathologist is that we help to prevent, assess, diagnose, and treat mainly these 5 categories. So I've made it really simple for you to understand. We help with speech disorders, language disorders, social communication disorders, cognitive communication disorders, and swallowing disorders. So I'm going to explain to you what these 5 categories mean. So when I say a speech disorder is when someone has little difficulty producing certain speech sounds, or there is a little problem in their voice is not sounding right, or they have resonance problems. When I'm talking about language disorders is when a person finds it difficult to understand others. They find it difficult to share thoughts. They find it difficult to share ideas and feelings. Okay. And a social communication disorder is when a person finds it difficult to use social cues. So, how to use your verbal and non-verbal communication in a social context. Okay. And a cognitive communication disorder is when a person finds it difficult to organize their thoughts, pay attention, remember certain things, may have word finding difficulties, can't get a particular sound or can't get a particular word. They have planning and problem solving problems. So we deal with all these type of disorders. We also play a role in people who have swallowing disorders, that is feeding and swallowing. So if you have problems when you're drinking or when you're eating something and you have choking or maybe nasal regurgitation, we do play a role in this as well. So who needs a speech language pathologist? Um, we as a field, we deal with all age range of people. So we can deal with someone who's a newborn right up to a geriatric client. Um, when newborns come to us, it's mostly for early detection and maybe if they have some feeding or nutrition issues. And toddlers and school age could be because of a delay in their language. It could be because they have been diagnosed with an autism, ADHD, cleft lip. As an adult, it could be when a person maybe has stammering, or it could be they have a traumatic brain injury. It could be when they have suffered from a stroke. So we help in rehabilitation of their speech and voice. In geriatric patients, we help with feeding and swallowing. If they have some memory problems or they are suffering from a degenerative disease. Okay. So now I'm going to move on to our role in with people with Parkinson. As you can see the picture I have showed you here, these are the some of the signs and symptoms a person with Parkinson has. You may have a tremor, you may have slowed movements, rigid muscles, impaired posture and balance, loss of automatic movements, and here I have highlighted speech changes. So the change in their speech and voice is a very common feature, common symptom with people who have Parkinson's. A large chunk of people suffer with either voice or speech problems over the course of their illness. So I cannot stress how important it is for a person with Parkinson to meet a speech language pathologist and get their speech and voice assessed and see how it can be improved if they are facing any speech or voice related problems. Okay. So I want to explain to you why a person with Parkinson gets these speech problems. So what happens is when you have Parkinson's, it affects your nerves and your muscles. When your nerves and your muscles are affected, this in turn affects your speech. So I've highlighted a few areas which, when the nerves and muscles are affected in these areas, they cause an effect on your speech, how you sound, how your voice sounds. So if the nerves and muscles are affected in your larynx, in your throat, in your respiratory muscles, roof of your mouth, your tongue, your lips, and your facial muscles, you can see a drastic change in how you speak and how you sound. Also, the nerves and muscles in certain areas of your brain, if they are affected, it may cause problems with your hearing, your voice, and how you process speech when you listen to it. So, people with Parkinson's face these problems. One really important reason why when our muscles in our respiratory system are affected, what happens is you cannot support speech. So you don't have the breath support that is enough to support speech. Your voice becomes breathy. You feel like you're going to just run out of breath when you're talking. You're only able to speak a few words and then you feel like you're going soft or your voice is strained and breathy. So these are the main speech problems most of the people with Parkinson do face. One of the very main one is reduced volume. A lot of my patients always uh, talk to me about their difficulty in talking louder. They feel their speech is very soft and people are not able to hear them. So that is one of the main speech problems faced. Also, people find their speech is in one tone. It's very monotone, monotonous. They're not able to change the tone, not able to change the pitch, okay, or the intonation. Another common speech problem faced is the voice is breathy, as I had told you. So the person feels like they lose their breath, not able to talk in a long sentence or a full sentence. They could have problems where their voice is hoarse or strained. Many people come to me and they tell me that they sound very painful when they are talking. They have to take a lot of effort to get words out. Another speech problem is the tremor. So the person with Parkinson does not only face tremors in their hands and legs, but also in their lips, in their jaw. And this creates their speech sounding very unclear and slurry also. Another problem with their speech is sometimes they cannot convey their emotion. If their facial expressions, the muscles in their face have been weakened, have been affected, then they find it difficult to convey emotions. And when they're talking, people may misunderstand what they mean. They have trouble pronouncing letters and words. Also, they have word finding difficulties. So they know what exactly which word they want to say, but they just cannot get the word. Some people find that their speech is too fast. Some people find their speech is too slow. Some people even have a problem of stammering when their speech is very fast and they tend to stammer, they tend to get stuck, they cannot go on, their speech is very bumpy and not smooth. Another speech problem is people feel that they always, people complain to them that their speeches sounds like they're mumbling, or at the end of the sentence it becomes inaudible, or they cannot, the clarity is good at the starting and at the end it just keeps reducing. Some people find it difficult starting speech. So they always say that the starting is a problem. Once they start, it gets better. And some people find it difficult following conversations. So as a speech language pathologist, when you come for an assessment, we assess you, your full speech and your voice. So we may give you something to read, we may give you a conversation topic, we may ask you questions, ask you to describe how your speech is, what difficulties you face. And after full assessment is done of your voice, of your speech, then a speech language pathologist decides an individual plan for you. What would benefit your voice depending on the severity of your problem, what exactly you're facing. Are you having a breathy voice, or are you having a hoarse voice, or do you have tremors, or do you have stammering? So it has to be a very individualized program for you specifically. Okay. So both the motor symptoms and the non-motor symptoms do affect the person's speech. So you can see this picture at the top right corner. So these are some of the motor symptoms that a person with Parkinson's do have, like tremors, slowed movements, stiffness, reduced facial expressions, changing in posture. So all these motor symptoms do have an effect on your speech. Example, slowed movements. When your movements are slowed, not only your hand movements and your movements of your legs are affected, but even the movements of your lips, your tongue, all the parts of your oral cavity that you really require to have a very clear speech. Okay. Even when if you're facing problems where you have reduced facial expression, weakness of the face, what happens is the person listening to you may incorrectly judge what you want to say. So you may give off incorrect verbal cues, non-verbal cues, and also it impacts ability to show emotion. Emotion is very important when you are having a conversation with someone. So the motor symptoms do play a major factor in the speech problems. Moving on to the non-motor symptoms like memory and thinking problems. These also affect speech. So these cognitive problems cause word finding difficulties. So the person is not able to get the particular sound or the particular word they want to say. And this is very frustrating, and this lowers the speech rate. And also, the person finds it very difficult to make a person understand what they are talking about if they are having a lot of word finding problems or memory problems. Okay. So these speech problems a person with Parkinson has causes a lot of frustrations. It makes it difficult to communicate with family and friends. It interferes with the job. It also limits your social interactions. And this can be very frustrating for the person with Parkinson. Um, that's why it's so important that you need to keep your speech, don't neglect it, but find solutions to it. Find out how you can improve your speech. Know that there are speech language pathologists that help you to work on your speech so that it gets better and these type of problems can be minimized. So I do say there are medical adjustments that a person with Parkinson can do. Sometimes it helps with speech problems, but speech therapy is the main treatment, and it is one thing that, as a person with Parkinson, or if you have a family member with Parkinson, know that it's very important. So, what we can do as a speech language pathologist, um, we help to maintain the communication skills that you already have. So we don't want you to lose out on the communication skills that you already have with you. So we help you to maintain it. We help you to learn certain techniques that help you to conserve energy. So we give you these techniques that help you to conserve energy so that you don't feel breathless. You don't feel like there's pain in your throat and you're not able to get the words out. We teach you a lot of techniques to help you conserve energy. And also, we also give the importance of non-verbal communication skills, which do help you to conserve energy and also help you to use it along with your verbal communication skills. So, in case you're getting tired, know that you can always use a nonverbal skill to help you, and so that you don't have to um, get stuck on a particular one when you are not able to say a certain word. We also teach you exercises to improve the muscle and strength and the movement. We teach you exercises for your face, for your lips, for your tongue, for your jaw. These exercises strengthen the muscles and the nerves in your face, in your oral cavity, which help you not only for eating and swallowing. So it does not only help you when you're having difficulty while eating and swallowing, or if you have a drooling problem, or there's excess saliva in your mouth. But these exercises also help you to be more clear. They help your speech to be very clear, and it reduces the slurring, and even it helps you to improve how you sound. Okay. So, and the third thing that we as a speech language pathologist does is we improve communication. We teach you techniques to help you increase your loudness. We teach you techniques to help you change your pitch, your intonation, so that you sound better, so that you can use different tones, different loudness. We also teach you techniques to make sure that you have enough breath support for your speech, so that you do not run out of breath and you do not um, feel like you're breathless. Okay. We also introduce assistive devices that help you in situations where your voice is not okay, you're not able to depend on your voice, and you need something to give you a little break during your conversations. These type of assistive devices can help you with your loudness also. It could help you when you have word finding difficulties and you're not able to get a particular word. Okay. So these are some tips I wanted to introduce to you all, just to improve your communication. Okay. So what I would always suggest is, whenever you have to communicate with someone, whenever you are having a conversation with someone, choose a quiet place. Choose a place where it has low noise levels, so that you are not competing with the background noise. Now, if it's a noisy environment and you have to compete with the background noise to get yourself heard to your communication partner, it would be all the more difficult if you're having problems with your loudness levels. So, if you're already very soft and you are trying to talk in an environment where it is already noisy, it's going to be all the more taxing and all the more tiring, and you will not be able to get your point across. One more tip that I could give you is, try to speak slowly. Try to go a little slower than your normal rate of speech. As you go slower than your normal rate of speech, automatically you have enough time to make each letter, each word sound very clear. What I have noticed with many of my clients is they try to get the whole sentence out very fast. And when that happens, you automatically become unclear and the words overlap, and then you sound unclear, you sound like you're slurring, and it's difficult to understand what you're trying to say. So it's very important to try to speak a little slower than your normal rate. Make sure your listener is looking at your face. When you are talking to someone, make sure that you are making eye contact and your listener can see your face, so that they can pick up on other cues, non-verbal cues, facial cues, so that it will help with them to understand what you're trying to tell them. Another clue or another tip I can give you is, try to use short phrases. Short phrases always helps when you have a breathy voice. When you feel like you don't have enough breath support, short phrases are good. Try to make your communication in short phrases. Try not to have long sentences where it takes a lot of effort, a lot of energy from you, and you're not able to have enough of breath support for that long phrase. One more very important thing is to make sure that you plan periods of vocal rest. Short periods. Try not to talk for a very long time. Maybe after 5 to 10 minutes, take a little break. Take a sip of water. Keep your throat hydrated. Because when you are constantly trying to speak, when you're constantly trying to get your volume higher, or you're trying to be very clear, it is tiring, it takes up a lot of energy, and it also can have an adverse effect on your voice. You may feel your voice is becoming very hoarse. Your voice is getting strained. You're not able to get the sound out. So that it's always good to plan periods of vocal rest. Little time. Don't speak continuously. Keep your throat very hydrated also. One more important thing, I think your physiotherapist and occupational therapist would have also told you is posture is very important whenever you are sitting, whenever you're eating, even when you're talking, posture is very important. So if you have a good posture, if you correct your posture, your voice becomes very clear. If you're hunched down and your posture is not right for your communication partners in front of you, but you're hunched down, your speech is also going to be unclear and soft. So keeping an upright posture is also a good tip. Okay. For people who have a lot of problems getting your speech louder, when even the techniques that your speech language pathologist has taught you and you have practicing it, but you still feel your voice is too soft and people keep asking you to repeat it. If people keep telling you to talk louder and you're not able to get that loudness, I would always tell you to maybe try an amplification device. That helps a lot. Some clients find that is really helpful when you use an amplification device. Okay. For people who are finding it difficult to get certain sounds, people who are finding it difficult to get certain words, one more tip which I normally suggest is try to write or type what you're trying to say. Even if you have, if you're able to do a little writing and you're able to write one or two words down, that will always help you. Okay. Try to establish a topic before you speak. So when you have decided you want to tell someone about a certain incident or you want to ask someone for something, it's always good to establish the topic before you start speaking. So your listener knows what related to what you're talking about, and also they're able to understand very clearly what you're speaking then. One more tip is try to use your non-verbal cues, use gestures for commonly recognized words along with your speech so that you get some breaks in between, so that you get little periods of vocal rest. Try to use commonly used gestures in between. Also, when someone is finding it difficult to understand what you are saying, try to use some gestures or use some non-verbal cues along with it so it's easy for them to understand what you're talking about. Also, one more thing is try to leave out unnecessary speech. Try to get your point across with short phrases and short sentences. Try not to um, make a long phrase or long sentence which is more difficult for you because of your breathing or because you're finding it very difficult to change your intensity or your pitch. Okay. So these are a few tips I just wanted to share with you all to help you improve your communication. You can follow these tips at home, and I think they are very easy to follow. Um, okay. So these are some of the alternative communication devices that um, I find help a lot of clients with Parkinson. The first one I think I've spoken about already is the amplification device. So these amplification devices are mainly used for people when they find it very difficult to get louder and they feel their speech is very soft. So these amplification devices help to improve that. Also, we do use sound level meters. These are devices that help you to monitor how loud you are. Some people with Parkinson are not aware when they are soft. So these devices help you to monitor how soft you are and give you a feedback or clue to go a little louder when you are talking so that you can monitor how loud you are. For people with Parkinson's who are unable to speak, alphabet boards and AACs, that is argumentative and alternative communication devices, are very much helpful. This is one example of an alphabet board. As you can see, there are alphabets and numbers, and there's also some questions at the side, and there's also no and yes. So the person with Parkinson can initiate a conversation when they're not able to get a particular word. They could say it starts with, and then they could show you the letter that it starts with. Or they can also just point to no or yes when they are unable to get their speech. Something easy that you all have at home are phones and laptops. These can be used as typing devices. Also, computers with do have voice synthesizers where you can type it out and then it speaks for you. These type of devices are also very helpful. Okay. For people who are attending the session who have family members with Parkinson, these are a few tips on how you can be a better listener. You First of all, I would suggest whenever you're talking to a person with Parkinson, try to make the environment less noisy. Also, you can ask the person these certain questions, like you can ask the person to look at you while they're talking to you so that you can get some nonverbal or facial cues. You can also ask many yes and no questions when they're having a day where their speech is very low or they're finding it really difficult to communicate. Asking yes and no questions is always better than asking them a question where they have to speak in a full sentence or they have to talk a lot. Also, asking a person to repeat is a very good tip so that when you have not understood them, instead of not paying attention to them or not moving on, ask them to repeat, ask them to maybe write it down, spell it out if you cannot understand the word or you can't understand what they're trying to say. It's always good when you can ask them for that clarification. Also, try to ask them maybe to speak a little slow so that they become more clear. Ask them maybe to spell out the words if you cannot get a particular word, or you can ask them to write it down. Okay, so these are some tips for family members who have a person with Parkinson at home. One more very important thing is always prepare for an emergency, especially if the person with Parkinson is a geriatric patient. It's always important to have maybe an intercom system, bells or buzzers, cell phones which have pre-programmed automatically dial emergency numbers, just so that the person with Parkinson can get help immediately whenever required. Okay. Other than the speech problems, a person also has a lot of swallowing problems. Person with Parkinson, there's complain about coughing, they complain about choking, a lot of throat clearing, sometimes drooling. They complain about saliva pooling in the mouth, and because of that, their speech becomes very unclear. So, as a speech language pathologist, we do help um, reduce these issues, and we also work with improving these issues in various ways. As I said, medical adjustments do ease these problems, but swallowing therapy is the main therapy and it's very important. Um, we do teach exercises to strengthen the swallow muscles. So we do a lot of exercises for your tongue, for your lips, for your jaw, for your face. These strengthen all the muscles and they help in swallowing, whether you're drinking or you're eating something. It helps all the muscles required to eat and swallow. So these strengthen them. And what I found is these exercises to strengthen the swallowing muscles also strengthen your speech. So it also helps you have a very clear speech and it helps you reduce the slurring of your speech. So it helps both in your swallowing as well as your speech. A lot of diet modifications also and tips how you can change it. Maybe if you are finding it very difficult to drink water or a juice, we tend to ask you to maybe thicken it so that it's easier. And we do a lot of behavioral strategies also to help you improve your swallowing and your maybe if you have a breathing problem. So these are the type of exercises that we give you as a speech language pathologist. So we work with your lips. We may ask you to take a deep breath and say ah, so that this not only helps for your to improve the muscles in your face and your tongue, but it helps also with your speech. So we do a lot of exercises for each part of your oral cavity, your lips, your tongue, your jaw, your palate. We do a lot of exercises for your cheeks. We make sure that your lips are strengthened so that you're not, so that food or water doesn't spill out when you're eating, or it helps to prevent drooling as well. We also help in strengthening the tongue, so, which is very important during swallowing and also while speaking. So some tips that I could give you, if you are a person who has a swallowing problem, is main thing is change your posture. Postural correction is very important. So I am sure your physiotherapist or occupation therapist would have informed you on what type of posture is good for when you are drinking water or when you're eating. Also, if you are choking when you're eating, taking smaller bites, slower bites while eating always helps. We also teach a lot of techniques to prevent you from choking. So that would be maybe tucking your chin to your chest while you swallow, or double swallows to make sure that all the food has gone down. Also, maybe thickening liquids so that you do not choke on them. Okay, so I got a lot of questions from all of y'all, and the questions were mainly on these topics. So before I go on to answering the questions that you all had, I would like to tell you all the process about meeting a speech language pathologist. So when you meet a speech language pathologist, after the assessment is done for your speech and language, and your speech language pathologist decides a individualized plan for you to help you improve your speech and your voice. Um, then what I normally, people have asked, some questions were asked, well, how often do you need to practice? Or how often do you need to go for a speech therapy session? So generally, when you have just started your speech therapy sessions, I generally ask my clients to come twice a week so that I can teach them the exercises, I can teach them the different techniques, and I can make sure that they are practicing those exercises and techniques in the correct manner. It is very important to learn the techniques in a correct manner so that you don't have any problem. If you're not practicing the techniques or the exercises correctly, it may cause more harm than good. So I would always advise you to meet a speech language pathologist and get the training on how to do a particular technique. Please do not Google it or watch a YouTube video and try to practice it without someone trained having taught it to you, because it might also affect your voice more. It might damage your voice in a different way. So always make sure that you're practicing the techniques right. Okay. What I normally always train my clients who have Parkinson's is I teach them diaphragmatic breathing, that is tummy breathing. That is one of the main things I always teach them, is to learn how to breathe from your diaphragm and not from your chest. Why this is so important is because of loss of breath. People with Parkinson always complain about a breathy voice or loss of breath. Okay, so learning how to use a proper diaphragmatic breathing always helps you to give you the proper breath support for speech. So when you're speaking, you need a good amount of breath support so that you can speak for a longer duration, for long sentences. Otherwise, what will happen is that you lose your breath, and halfway through the sentence, you're not able to continue. You become very soft, or you lose your breath and you mumble, and your sentence trails off, and you cannot hear yourself. I mean, a person listening to you cannot hear you. So that's the first thing I always teach my clients is proper diaphragmatic breathing. And I have found that these breathing exercises not only help you to get a good breath support, but it's also very relaxing. So it does reduce the strain. It does reduce um, you feeling very tensed in your muscles. It does help in that also. The second thing I always train my clients is a lot of oromotor exercises, like I have been speaking about. So, a lot of exercises for your face, for your lips, for your mouth, for your tongue, and jaw. These exercises help to strengthen your muscles, it helps to strengthen your nerves, it helps not only to support your eating and your swallowing, but it also helps to make sure your words are clear, so you don't feel like your people don't feel your speech is unclear or you're slurring. This also helps, these exercises help to strengthen it, because when you're speaking, you're using all these parts. You're using your tongue, you're using your lips, you're using your jaw, you're using your cheeks. All these are very important for us to speak, to get each sound right, to get each word right. So these exercises help for your unclear speech and for your slurring. One more thing that I do teach also is maybe a laryngeal massage, a throat massage. Okay, we do neck exercises, shoulder exercises. These are all relaxation exercises. So it reduces the strain on your throat. It reduces any tension that you may have in your shoulders and throat, which is causing your voice to be very hoarse and strained. So these exercises always help that. I do also, as a speech language pathologist, we do have a lot of other techniques to help with strained and strangled voices. So I can name a few that we generally teach. So these exercises not only relax you, but also increase the stamina of your voice. They are like vocal warm-up exercises that we do. So I always train you to do these vocal warm-up exercises, which help you not only your voice, so that your voice is not too hoarse, not strained, but also your voice increases in volume and also helps with your pitch changes. Some of these techniques which we train you are, um, are called yonsai or chanting techniques. But I would suggest that you get trained by a speech language pathologist for this and know how to use these techniques in the right manner. Okay. Um, Some people ask questions about tremor. They feel they have tremor in their lips, in their jaw, which is causing their speech to be very slurry. We do have techniques to help reduce these tremors. One such technique is called a lip trill. It helps when you do these techniques in the correct manner, and it helps to reduce the tremors. So there are various techniques that a speech language pathologist can train you to reduce your tremor so that your speech is more clear and there's no slurring. We have techniques also to change the range of the pitch and also to increase your volume. So, one thing I always do is first I make the patient very aware of what type of pitches they are using, what type of volume they are using in conversation. Are they able to go a little higher in their volume? Are they able to change their pitch? So we do a lot of these games, these vocal games where we glide from maybe a low pitch to a high pitch and a high pitch to a low pitch to make sure the person knows that they can reach these different pitch levels. The same thing we do for volume. We play around with the volume where I ask the person to glide maybe from a low volume to a high volume and to go from soft to loud. And these type of activities really help them in increasing their volume and speaking louder than they can. Okay. When it comes to stammering, it depends on what type of stammering you're having. Is the stammering where you are getting a block and you're not able to get any voice out? Is it where you're repeating a particular sound, particular word? So, or if you are getting stuck on a particular sound. So it depends on what type of stammering you have, that we train you for different techniques, how to deal with it. So according to the type of stammering, there are different techniques on dealing with it. Okay. People who are finding it very difficult to get words out or particular sounds. These type of problems are mostly where the cognitive aspects are affected. So maybe we work with their organization skills, we work with their planning skills, we do a lot of exercises where the person has to name certain objects, and also we do exercises to improve their memory. So we do a lot of these exercises to improve the person and ability to pick up words so that they don't have these word finding difficulties. So as a speech language pathologist, we deal with all these issues, and but I would suggest always get in touch with a speech language pathologist, learn the techniques in the right manner so that you do not cause any harm to your voice, to your vocal folds. Because what happens is, if you are continuously talking in a hoarse or strained voice, or if your voice is very breathy, that puts a lot of pressure on your vocal cords, and that could cause other problems like a little nodule on your vocal cord. It could cause times where you have lost your voice and you just cannot speak. So it's always a very important thing where you concentrate and you do the techniques in the right manner, and you do not damage your vocal cords or do anything where it hurts you more than it helps you. So it's always very important to do all the methods, all the techniques in the right way. Okay. If you all have any more questions, you all can get back to me. I just want to let you know that I do online speech therapy also. If you have any doubts, any problems, you can always get in touch with me. And I think we're going to have a question answer session now. So I will
Yes, there are a few questions already in our chat
Okay.
box. So I'll just so thank you, Lara, for your very informative session. There is a question actually related to how to train or stimulate the swallowing technique while eating instead of prolonged mastication.
Okay. Does this person have choking? Did they mention anything like that?
No, they didn't
Okay.
say.
So this is while eating, right?
Yes, yes.
Okay. So I'm going to assume that this person is having maybe choking while eating, and maybe when they are eating, the food either goes in the wrong windpipe and they start choking and they're not able to eat. So we do teach a lot of techniques, example like double swallow. So whenever a person takes a bite of food, we always tell them swallow twice. Make sure that all the particles of food have gone down. There are no particles remaining in their mouth or in their throat that may cause them to aspirate it and start coughing. Another technique we do also teach is the chin tuck technique, where it gives them more power to swallow. So it's a more forceful swallow to make sure that all their food is swallowed down. I hope I answered your question.
All right, thank you. Another one is do LSVT exercises help? How?
Yes, LSVT exercises help a lot. They generally help people who are finding it very difficult to increase their volume of speech. So their voice is very soft, their voice is breathy. These type of exercises help them a lot to get increased volume of their speech. And but LSVT also helps for clarity of speech as well, not only for their loudness. So it's a very good uh, program which helps people with Parkinson's.
Um, how to manage the fluency and initiation of talk by persons with Parkinson's?
Okay, so I think I did go in detail about stammering. I think maybe they're talking about people with Parkinson who face stammering, if they're talking about fluency. So that all depends on what type of stammering they have, whether they have a block or they have repetitions. So there are various techniques. So that just all depends on what type of stammering they have. If they're talking about word finding difficulties, then we do work with a lot of memory and naming exercises.
All right, fine. There are a lot of questions again on how to prevent drooling. So, is there any
Okay.
besides?
Yes. Okay. Drooling is one of the main problems people are facing with Parkinson. The first thing I would always say is make sure your posture is correct. Okay, you're sitting upright, you're not bending forward. Always make sure your posture is good. Second thing, it's always good to work with your lip and jaw muscles so that your saliva, the drooling doesn't happen. So your lip seal is very important. So make sure your lip seal is strong. This can be done with a lot of exercises for your lips and for your jaw and for your tongue. This helps a lot for drooling.
All right, thanks. Another one is how much improvement is seen with speech therapy.
Okay. I would always say it depends on the severity of your speech problem. But saying that, I would say speech therapy helps in whether you have a very mild speech problem and also very profound speech problem. It all depends on your severity and what difficulty you're facing. But speech therapy for sure will help you increase your volume, will help you speak with more tone, will help you speak with proper pitch difference and different intonations, will of course make your speech much clearer. So if you follow the techniques, if you follow the exercises that your speech language pathologist provides you and teaches you, most definitely you will have a good prognosis. What I always find is, if you are practicing the exercise and techniques every day or as many times as your speech pathologist has told you to do, I'm sure you will have improvement in your speech.
Thanks, Lara. Do you all have? I don't think that we don't have any more questions on the chat box. If anyone would like to ask a question directly, can you unmute yourself? There is a question: can singing help?
Yes. Singing is something which is really wonderful. Singing uses a different part of your brain. And I have noticed in a lot of people with Parkinson's and even with dementia, even with stammering, singing techniques and singing related techniques and exercises brings about such a change that it is really wonderful. So I would definitely say singing helps. Um, we do incorporate a lot of singing and singing related techniques to help with people with Parkinson's as well. So that is
Uh,
something.
there's another question about what could be the approximate cost of a speech therapy sessions. Normally, what would be
Understood.
charges?
That depends, I think, from which state. Also, it depends if it's in the city, if it's out. But it's around maybe 500 to 800 per session. But I am sure if a person has any financial problems and they get in touch with a speech therapist, I'm sure people would give you discounts and would, uh, if that is an issue, that would also be there. So it's always best to get in touch with a speech language pathologist and ask them if you have any issues as well.
All right. There is another question about how about Om chanting, etc.
Yes, yes. A lot of people find chanting particular slogans or even Om very important or it helps them with their speech. It's like a drilling activity that it does help you. It may not, you don't have to chant Om. You can also just chant different sounds like Ah or E. Those type of things also help you. So these are generally vocal warm-up exercises. So your speech language pathologist would teach you these warm-up exercises. So whenever you have to read something or you have to speak to someone or you have to talk for a longer duration, these vocal warm-up exercises help you to increase the stamina of your voice. So we would always advise you to do the vocal warm-up just before you have to give a speech or just before you have to talk a lot.
Um, uh, there's another question about how many minutes speech exercises are needed daily.
Okay. So that all depends on what type of exercise you're practicing. What I normally tell my clients is even if they can just keep 15 minutes in the morning and 15 minutes in the afternoon or evening whenever they're free, twice a day, that would show great results in their speech. So it's not like they have to spend hours on it. It can just be 15 minutes in the morning and 15 minutes in the evening, which show great improvement.
All right. There's another question about is there any exercise which can prevent occurring of speech problems in the future?
Okay. I guess this question is for someone who's not facing any speech problems at the moment, who has Parkinson. Yes, of course. I would never say that you don't go to a speech therapist for this. It's always good to be prepared to know what type of issues you might face in the future. A speech pathologist would give you exercises um, just to increase the strength in your oral cavity. It could just give you some exercises to make sure that your speech is very clear. I don't think there's a harm in doing it before you have a problem also.
All right. There's a question related to how does stress and anxiety affect speech? What would you
Okay.
suggest for that?
Okay. So when there is stress, I could explain it like a circle. So if you are stressed or you're anxious, automatically your speech is affected in certain ways. And when your speech is affected, you get more stressed and anxious. It's like a vicious circle. So it is always important to manage your stress levels, manage your anxiety levels, so that it does not have an adverse effect on your speech, because it's a vicious cycle. So, yes, stress and anxiety definitely affect your speech and voice.
All right. Is there a link between speech and hearing?
Yes, of course. Yeah. Is this related to Parkinson's? Are they asking about that?
I don't think she not specified anything, so I just it's just a general question.
Yeah, definitely. As you know, I've done my master's in audiology and speech and language pathology. So, audiology is hearing. So, there's definitely a link between hearing and speech. Even when we are having a conversation with someone, we depend so much on hearing. If you're not able to hear the person, if you cannot process what a person is speaking, it is difficult. So, if you are a patient with hearing problems and Parkinson, yes, you will face different type of issues.
All right. There is a question related to this person says, my wife is totally bedridden and cannot express anything by word or action. Can this stage be cured? And what communication strategies can you suggest?
Yes. For a person who is bedridden and is not able to communicate at all, I would always suggest to have maybe a communication board. So you have a communication board, even if it could be either written words, it could be pictures for their basic needs. Like if they're hungry, there's a picture for hunger, there's a picture for pain, for water, if they need to go to the bathroom, if they want particular things like the TV remote or any particular things. Communication boards help a lot in these cases. Like I showed you, the alphabet board or the AAC devices, those help a lot, because it is very frustrating for the person who's bedridden when they're not able to communicate with their family and friends. And these type of devices do help to alleviate the problem. So yes.
And there's another one. What are the signs that speech issues are developing in a person with Parkinson's?
Okay. So if you feel like people keep asking you to repeat yourself, if people are not understanding what you're saying, if they're saying you're talking too softly, you feel you're people are keep asking you, please repeat, you're too soft, be little louder. Those could be signs that you are developing some speech problems. It's always good in these cases to go contact a speech therapist and get treatment for it, learn the techniques before it gets worse.
Um, I feel my speech lowers when it matters the most. Why does that happen?
Yes. I feel the main issue in when a person feels their speech is too soft, or they're not able to get a very high intensity, get louder when they're speaking, is related to your breath support. Always breathing and speaking are very interlinked. So I would suggest learn how to do diaphragmatic breathing. Make sure you're not breathing from your chest. Breathing exercises would help you in this case, along with a lot of other techniques that a speech language pathologist would suggest according to your voice.
All right, fine. I think we don't have any more questions. Shania, do you have any?
No, not yet. Would anyone like to unmute themselves and ask directly? अगर आपको unmute करके पूछना है आप वो भी कर सकते हैं.
Um, there's a question here. The slightest irritant in my throat affects my speech. Any advice?
When you're feeling like your throat is very irritated, or it's um, you always are coughing, or you feel like something is there in your throat, and that whenever you speak you start coughing, or there's some irritation, what I would suggest is try to have a very healthy vocal hygiene. I could give you a few tips. Is one really important one is making sure your throat is hydrated. Okay, so whenever you have to speak, keep a little water in a glass at the side. Take small sips. Make sure you are taking small sips and talking. That does help in a lot of ways. Also, what I would suggest is um, try not to eat too many oily or spicy foods. That also could relate to it. Caffeine in caffeinated drinks or coffee, tea also dehydrates your vocal cords. So I would suggest reducing on that too. These type of things do help when you have irritation in your throat.
All right. There is a question here. Does eating sweets create problems in speech?
I think eating sweets causes other problems, but I don't think it really causes speech problems. I think eating sweets may not be healthy choice for you, but it will never create a speech problem. No, I've never heard of that.
All right. Thanks. Lara, there is a question about how to tips to improve phone conversation.
Okay. Yes, that's something that everyone faces a lot of problems with. I think now phone conversations are becoming much easier now, since there's always a option of a video call, so that you can also have non-verbal cues and facial cues that also help with the clarity of speech. So what I would suggest is whenever you have to talk on the phone, try to take room where it is quiet. There's no other sound. You're not trying to talk over some other sound, so that you don't have to compete with another sound. Second thing I would always say is try to do video calls if possible, so that the person can get clues from your face as well. And try to have short conversations. That is always important. Take some vocal rest in case you have to talk for a very long time. So don't talk continuously. Talk for a little while, take some time off, keep a glass of water with you, take sips of water, so that your voice is your throat is not dry and it's hydrated. That's something I would suggest. Also, if you could use headphones or speaker, that would of course help you when you are taking a phone call or a video call.
All right. I think that would be all. You've
Yeah.
answered a lot of questions. Thank you very much. All right. So
Yes.
thank you for giving us your time, and thank you for so patiently you have answered all the questions of our
Thank you for having
people.
me. It was
We are
very
very
interesting.
we are very grateful for your participation, and we hope that we can associate with you in the future as well.
For
So
sure. Yes.
thank you all for participating in this webinar. If you all have any further questions, please get in touch with us. Our society also has support groups for people with Parkinson's. So we are sharing our details once again. Please get in touch with us if you are not part of our groups at the moment, or if you know someone with Parkinson's who can benefit from this. So thank you and have a good evening.
Thank you, everyone. If you'd like to re-watch it, it's available on our YouTube channel on Parkinson's NGO India. And we look forward to connecting with more of you for our future webinars. Thank you. Have a nice day.